Okay, we live. Good evening, everyone. Hi, I'm your host. This is Blue Table Talk, and I'm your host, Deborah Jones. And it is a pleasure to be back on the air tonight. I have been off a couple of weeks and taking care of some business, but I'm back now. I might have to go back out in a couple of more weeks, but I will return as your host, Deborah Jones, and for Blue Table Talk. Now, don't forget that COVID is still out there. I know we got a little relaxed about it now that some people are not wearing their masks and not doing what the necessary features they're supposed to do. But just still be careful. You know, in some places, still wear your mask. If you're in a large crowd, still wear your mask. Still wash your hands. You're going to do that anyway. And still keep your distance. You know, now people like buck up on you in the stores and everything. But, you know, kind of ask them to move back a little bit, give you some room, don't be in your space as much so that you can at least, you know, get yourself together. So don't forget that we don't have too many people in the hospital. There are too many people that are sick with the COVID right now, but it's still out there. And the Delta is as well. So if we even get another variant, you guys, we have to be careful. We have to take care of, we have to take precautions and do what we need to do. And probably go back to the mask, go back to the washing the hands, go back to the distance. So let's do what we need to do to so that we won't get sick or we won't get others sick. So so tonight we have a great guest on tonight. We talk about a subject that a lot of people don't even understand it, and a lot of people don't even know anything about it. I know that I just know a little bit, and when I say a little bit, I mean a little bit about it. But tonight I'm bringing to you our guest. Her name is Katina Williams. Hi, Katina. How are you tonight?
Hey everybody, how are y'all? Hey.
Thank you for coming on tonight to talk about lymphedema, and so I appreciate you. I appreciate you accepting the invitation.
Oh, thank you for having me.
Oh, you don't, no problem. So, Katina, can you give us a little information about yourself, a little introduction, not a lot, but just a little bit, because we want to get into this subject.
Okay, yeah, I'm Katina Williams. I'm a LVN. I've been an LVN for like 22 years, and I'm also a certified lymphedema therapist through the Norton School of Lymphology. I've been doing that for 10 years. So I work here in Beaumont at Baptist Hospital, where we have our clinic there, and sometimes I do some work on the side as well.
Okay. So if you Joette is on. She say, "Hey, Katina," and also
Hey.
Belinda Howard. She's on. She says, "She has it." Okay, so we want you to ask some questions about it because we need to know more about it. I know Katina's going to tell us a lot about it, but talk. We want you guys talking to her, and as you guys are on tonight, do me a favor and share the video, share this video because we are on Facebook and we on YouTube. So go ahead and share because sharing is caring. If you care about what's going on in our lives, go ahead and share this podcast, and so we could talk to Katina. Katina, what exactly is lymphedema?
Lymphedema is chronic swelling of rich protein fluid that accumulates in the interstitial spacing. So basically, it's a part of our lymphatic system where the toxins flow throughout the body and it gets trapped in interstitial spacing and it has nowhere to go. And it's like a roadblock, a traffic block, and everything just stops. And then the fluid just starts accumulating and accumulating. It's not just your edema, which is like clear liquid. Lymphedema is chronic protein mixed with, fluid as well.
Wow, can it be treated?
Yes, it can be treated, but it's not curable. Although now, basically, people who've had like breast cancer, they're doing surgeries where they redirect the lymphatic system, put in stents. So this is new stuff that's developing. I have like a few patients who have had it. I can't tell you any major results from it because they're still getting treated. That it's not like 100% cured as of yet. So this is new stuff that they're coming out with. Is it good? Some people, if they catch it early, it can be reversible. But if you've had it for years and you try to get the surgery, then sometimes it takes a little bit longer for the new lymphatic system to kick in.
Wow, wow. So where is it located in your body?
Lymphedema can be, when I say anywhere on your body, I do mean anywhere. It could be head, neck, your
Wow.
breasts, your arms, your stomach. People have what they call a pannus, or some people may classify it as an apron, you know, when your stomach then past your belt, and you can develop lymphedema in that. You can develop lymphedema in your legs. Women can get it in the vaginal area. Men can get it in the penile area, and also in the scrotum.
Really?
Yes, because your lymphatic system goes throughout your whole body. So if you have any type of damage, any type of surgeries, trauma, infections, people who've had cancer, had radiation treatments, the radiation damaged the lymphatic system and the lymph nodes, so that the lymph fluid can't be uh, going through the body like it's supposed to, or like it needs to be. So everything starts shutting down and things start swelling up. It's like like I said, like a roadblock that happens due to the trauma, and the lymphatic system, once it's damaged, it does not know where to go. So that's where I come in, because we redirect it to go to healthier areas in the body.
So when you talk about redirected, what do you mean?
When we redirect it, we do what we call manual lymph drainage massage. So basically, what happens in our body with the lymphatic system, everything in the axillary nodes, right up in here, controls everything above the belly button when it comes to the lymphatic system. So just up in here, it moves just up in here. The inguinal node is right there in the crouch area. That's your inguinal node. It controls everything below the belly button. They never cross. So basically, if you have swelling above, what we do with the massage, we move the fluid to go down into the inguinal node. And if it's in the legs, we move it to go all the way up into the axillary and also the abdominal area. So it can pull all that fluid back out.
So are you telling me that people whose stomach is large or big, whatever, it could be lymphedema in there or whatever?
It could be, because you can develop lymphedema anywhere. It's just that it would have to be assessed. I can't just say, oh, you got a big fat belly, that's what you have lymphedema. There's lymphedema, and then there's adipose, which is fat tissue. So it's like learning the textures, learning what's going on. So when a patient comes in, we ask like 1,000 questions so that we can get the answer, like, is it really lymphedema or is it something else? So you can't just say, because I got a big fat stomach, oh, I got lymphedema. No, there's questions that need to be answered first before we even say that. But so far as for the reason why I say we direct it into the abdominal area or whatever, we have like a whole bunch of lymph nodes in the abdominal area that catches all the fluid that we needed to catch to get the fluid moving back out of the body where it needs to go. Which a lot of people ask, well, where does the fluid go? It goes throughout the body. When we do the massage, we work on the thoracic duct area, the neck, where the thoracic duct is. That way the fluid goes up here, and then it goes down into the heart. From the heart, it goes throughout the body, hit the kidneys, and then you pee it out.
Wow. Gwenda says she has it. She says she said hello first.
Hey.
She said she had
breast cancer.
cancer. And so she also said, hold on, let me get to it. I got it in my legs and arms. And Jeanette says I have it in both legs. And then Joeltha says I have it in my whatever.
Legs.
In her
That's
legs.
her legs. Yeah.
Okay, so you are you the one that your clinic, are y'all the one that move it around in their legs, or are they patient of yours and you help them out or whatever? I know Jeanette isn't, because Jeanette doesn't live in Beaumont. She's out of state. But do you help them move it around in their body, and can they go home and do the same thing?
Everything we do in the clinic, we teach them, because again, it's not curable, it's treatable. So everything that's done in the clinic, we teach them. We teach them how to do the lymphatic massage. We teach them how to do wrapping. I didn't say that one, but yeah, when we treat lymphedema, with through manual lymph drainage massage, through bandaging, multi-layer bandaging, compressions, and then also patients get a lymphatic pump to help push the fluid out as well. So everything that's done in the clinic, we teach them all of this stuff. We try to get them a pump if insurance approves it, for them to be able to treat it at home.
So does insurance improve lymphedema?
Good luck with that. Sometimes it does, and sometimes it do not. Yes, like patients will come in, we try to get them a pump, but the insurance will deny it. Sometimes patients need bandages for us to do the treatment. Insurance denies it. So then the patient has to pay over $300, sometimes $400, depending on how bad the lymphedema is. They got to pay out of pocket for the bandages in order for us to treat them for the lymphedema. So some patients have good insurance. The patient will go ahead and snatch it. but then sometimes they don't. The patient has to pay out of pocket for everything. So not only do they have to pay out of pocket for the bandages,
Mhm.
once the treatment is done, we transition them into some type of compression garment to help maintain. Again, some insurance will pay, some insurance do not. That's another expense have to come out of the patient's pocket to pay.
So Gwenda and Joetta both said they both have pumps, and Joetta said she is a patient of yours, and so Gwenda said her insurance pays. So it must
Yes,
be
that's it.
like you said, some insurance pay and some insurance don't.
Right.
So
Hmm.
okay, so so I saw I had the opportunity to see Jeanette Washington, who's on here, who says she's having in both her legs. She sent me today. She sent me pictures of her legs, and they were really, really huge. It all. I mean, I was just like, wow, and it felt so. I felt so bad because you know I might have. I don't even know it. How could I? How would I know that? Like I told you before we came on the air, my ankle swelled up, and it's just probably just mind over matter. My ankle swelled up this weekend, and it could be because I danced all the weekend. That could be it too. And
Or
my,
you ate too much salt.
I don't eat salt. I don't eat.
Okay.
Yeah, I don't eat salt, but I eat sweets. But
Ah,
I had cramps. I had cramps. So
uh-huh.
what I did, I elevated my feet, and the swelling went down. And plus, I wore some compression socks. So
Oh, okay.
and it went down. So how would I know what it is? Just go to the doctor and they can tell you or what?
Huh. Interesting enough, a lot of doctors do not know about lymphedema, but because the swelling went down, it wasn't lymphedema, it was just regular edema. Yeah.
Wow.
So interesting. Yeah. A lot of doctors do not know. They'll put a patient who's been swelling for multiple years, they'll tell them they're fat or whatever. They'll put them on a fluid pill, tell
Mhm.
them to lose weight. But what they don't know is that they do have lymphedema. How can you tell that you have it? Let's say that you elevate at night, your swelling don't go down. You take fluid pills, your swelling don't go away. Another key indicator is your swelling. If you have too much swelling, some patients develop what they call cellulitis, which is a chronic infection, not really a chronic infection, but an infection that happens on the skin. It is treatable with antibiotics, but if a patient develops cellulitis all the time in their skin because of the swelling, that's another key indicator that they do have lymphedema. And
Can
they do have mixed diseases. They have some patients who suffer with chronic venous insufficiency, um, and that can turn into lymphedema as well because the swelling just you damage the lymphatic system, and when the lymphatic system is damaged, then the lymphedema will start.
So before I go to Jeanette's question, what's the difference between lymphedema and endema?
Edema is basically just pure fluid, just pure liquid, you know, but it can be developed because of heart problems
Hmm.
or kidney problems
Hmm.
or eating too much salt, trauma, all that can develop just edema. Lymphedema is basically protein rich fluid. So that's
Hmm.
a difference. It's a different texture, different thing. So that's the difference between the two. One is just pure fluid, one is mixed with protein fluid.
Right. Jeanette says she had primary lymphedema, first nose swelling at age of 7, and she does
Right.
have a pump. And
Yes, a lot of times if they have primary lymphedema, the insurance will pay out of pocket. I mean, they will pay for a pump sometimes. We
so
have
that's
run into some glitches where they don't.
when the first notice that you do have an edema, I mean lymphedema, then they start paying. But then as you go on, they stop paying or what? The insurance.
It's just that depends on what insurance you have. Some insurances are good, they will pay. Some insurance will not pay. A
Mhm.
lot of times, Blue Cross Blue Shield, sometimes we have trouble with them. Another insurance like a Medicare Advantage plan, sometimes they pay and sometimes they do not pay because they fall under Medicare guidelines. So it's a give and take. It's like, let's just try it. We're going to try it and see if they approve. Sometimes you got to go through all the red flags. With Medicare, the guidelines is Have you done any exercising? Have you done elevation? Have you done any type of compression? Have you bandaged? Have you done all this for 30 days? If you've done it all for 30 days, okay, well then, yeah, we'll see about getting you a pump. And
So
then
when
it's just a basic pump.
you're talking about bandage, what you mean?
Bandaging is multi-layer bandaging. Multi-layer bandaging, it's like an ACE wrap, but it's not an ACE wrap. So
Right,
with the ACE wrap, when you pull it, it stretches big time.
right, right.
But the wraps that we use is called short stretch. So it only has a short of a stretch in it. So there's a difference. You don't just take no ACE wrap and say, okay, let me wrap it around my leg, it'll get it out. No. So the reason why we use the short stretch is because when we bandage them up, the more they exercise, the more they move, the bandage works against each other to help push the fluid up. With the ACE wrap, there's no moving of anything. It's just constricted. So what we're trying to do is get that fluid up and moving. So that's why we use what we call the short stretch bandages.
Right. So Gwenda said, you would know my legs are huge, more than 69 inches. She also wanted to know, she said she had, that's big now. I have Humana. Can you take that?
Yeah, well, the hospital, yes. More than likely, they'll have to have a referral from the doctor to be sent over to the hospital at Baptist, and then they'll do all the legwork with the insurance and everything.
Wow. Does it cause infection?
Yes, the cellulitis. Like if it's untreated, if the lymphedema is untreated, then yes, you can develop what they call cellulitis, which is a skin infection. And you'll know if you have it because some patients develop fever. It's hot to touch, it's red. And
Mm-hmm.
when you try to touch it, you just feel the heat radiating and it increases so much pain as well.
So even if you touch it, you feel pain,
Yes.
right?
Yeah,
Okay.
you do not want to touch a patient who has cellulitis legs. They will probably punch you. No, I'm just joking. But yeah, they're very, very painful. Very painful.
Please don't tell me that lymphedema is an African American disease.
No, it's not.
It's not.
Everybody get it.
Right.
Everybody gets it.
Because
Yeah.
every time
Anybody.
you turn around, oh, that's the African American, and they got this. Oh, I don't want to hear that. So, what type of exercise should they do, or should a person do who has lymphedema?
Okay, first of all, they want to wear compression wear. So if they have the bandages, that's great. If they have compression wear or Velcro wraps, any type of compression wear that they have, wear that. You could do walks. You could do leg raises. You could do bike riding. If you want to go out and do some jumping jacks, that's good too. Any type of movement, it helps to keep that fluid up and moving. Some people also do what they call rebound, which is a trampoline, a little small trampoline, and they hop on it and jump on it. That's also good as well.
But
Because
when
what
that hurt,
happens is some patients do have pain, but mostly when it's lymphedema, it's not really pain, it's just heaviness and pressure from all the weight of the fluid. But like
mhm.
I said, some people do develop the pain because of the stretching of the skin, you know. But it's good exercise though. And the more you get on the rebound, it helps to keep that fluid moving upward in the upward direction with compression on.
Okay, so Gwenda asked this question, but I'm sure she have to call the clinic. When can I come and what time? Yes, you have so much heat in your body. So I guess she wants to come to the clinic. She would have to call the clinic, right?
Yes, ma'am. Yeah, you call Baptist Hospital. Yeah, our number to the lymphedema clinic is 409-212-6121.
I'm gonna put that on the which call. And that's Baptist Hospital, what?
Yes. Baptist Hospital is outside of the hospital. It's
Okay.
810 Hospital Drive.
Okay. So do they have is there a special diet they have to be on or what?
Low sodium. We try to watch your salt intake. And a lot of people, they will say, oh, I don't eat salt. I don't do this with salt. But let me tell you, salt is in everything you eat. Like my nurse
Right.
practitioner who I work with, she'll tell you there's 200 milligrams of sodium inside cornflakes. So even if you eat cornflakes, yes,
Really?
yes, ma'am. Start reading labels. labels tell it all.
Yes, yes.
Yes, labels tell it all. So it's Yeah. Even milk has salt. Bread has salt. Everything you eat has salt. If it's processed, canned goods, loaded with salt. So we tell a lot of patients to eat frozen or fresh vegetables, or frozen vegetables, but try to stay away from canned goods because canned goods are loaded with sodium. Also, you'd be surprised, even though it's a healthy TV dinner, if you
Mm-hmm.
check out the sodium contents on it, it is loaded with sodium. Yeah.
Wow. So you told me your make as an LVN.
Yes.
What made you decide to go into this profession as far as
So I was
lymphedema therapy?
working for this home health agency and I was tired of doing what I was doing. And I was sitting in the parking lot and something said, "Look up." And I looked up, and on the billboard it had wound care and lymphedema. I said, "Oh, wound care." I didn't care about the lymphedema. I said, "Oh, wound care," because I love wounds. So I said, "Let me call them and see if they hiring." And so the receptionist said, "Oh no, we're not hiring any nurses." And I was like, "Okay, Lord, why did you tell me to do this? And why did I call these people?" 2 seconds later, this woman calls back. She said, "Are you a nurse?" I said, "Yes, ma'am." She said, "Did you call?" I said, "Yes, ma'am." I said, "I was calling to see if y'all were hiring." She said, "Yes, we are. Go ahead and put in your resume and all this other stuff." I said, "Okay, cool." She gave me all the information. So at that point, I hung up. Okay, Lord, you told me to do all this, but I don't have no resume. So I got home and I got on the laptop and I got me a little resume going, submitted it, and here I am today.
So
Yeah,
how long you been
it's
doing it?
crazy how that. I've
How,
been doing this 10 years,
how long you been a nurse?
22 years.
Wow, you look like you're 22.
Yeah, I no. No. And actually, my goal was to go back to get my RN before I turn 50, but it's too late to do it now because I'll be
Never too
50
late.
this year. Well,
Never
I'll be 50 this year. So I'll just
too
say
late.
now I'll be 52 before I finish.
Telling you, I'm getting ready to go into another career in my life, and never too late. And I will be years old.
That's a good one.
Lymphedema mean that you have with it? Was it immune compromise?
Immunocompromised?
Yeah, immune
No,
compromise
not
make
really.
you more
No, it's a
affected to COVID-19 or what?
no, ma'am. It's not immune compromised. No, it's just that your lymphatic system is just shut down because of trauma. It's a difference. So yeah, the only thing you're at high risk of catching is because of the swelling is cellulitis, but not really all this COVID and all this other stuff. That's just based on your immune system.
But
Kind of like
I'm really not understanding how a person could contact or get the lymphedema.
okay. So there's two types. There's primary. I think somebody said they had the
Yeah,
primary,
GX, uh-huh.
and then there's secondary, something acquired. Basically, with the secondary, you could develop it through surgeries. Anytime you get cut on, your lymphatic system is right under your skin. So as
Hmm.
soon as you get that surgery, guess what? Your lymphatic system is damaged because your lymphatic system sits like right under your skin. So since it sits right under your skin,
Hmm.
you cut it, it's damaged. Now you can develop lymphedema. Trauma, you can fall, you can hurt yourself. Again, anytime you fall, you hurt. The lymphatic system sits up under your skin. Since it sits under there, you damaged it. So the fluid does not flow. Not to say that every time you get cut on and every time you fall, this will happen.
Hmm.
Everybody's body or genetic makeup is different than others. Some people can get cut on, fall all day long, and they will never develop any swelling. They just got a very good genetic makeup. Okay. Some people get cut on and all of a sudden they start swelling. If you notice, a lot of times people who have surgeries, what happens? Their legs start swelling or such and such starts swelling. That's because the lymphatic system becomes damaged. Some people, even after the surgery, their swelling goes away. Their lymphatic system is just good. And some people who swelling never goes away after the surgery, okay, well, now their lymphatic system just got shut down. It got traumatic injury. And then all of a sudden the lymph fluid just starts backing up because now we've created this roadblock because our lymphatic system got damaged.
So what's the
Now,
surgery for?
surgeries could be anything. You could have knee surgery. You can have a hysterectomy. You can go have, I don't know,
Oh,
breast cancer surgery.
just any type of surgery, not surgery for.
Any type,
Okay,
right?
I
Any type of surgery. any
Mhm.
type of surgeries can develop, you can develop lymphedema, because again, anytime you get cut on, it that's a roadblock happening.
Right. Jeanette wants to know, have you worked with lymphedema patient that has had a knee replacement, and what is the success rate? I developed
Yes,
cellulitis and it affected my knee replacement.
correct. Yeah. Uh-huh. Because of all the swelling. Like I said, if you have a whole bunch of swelling, you can be at risk for developing cellulitis. So yes, we do have a high success rate. I should have brought my book. I can't find it. They hid it from me. But I do have a book. We call it a book of hope. So if they come into the clinic, I'll try to find it and I'll show you where we've had patients who've had like big swollen legs. By the time we've done treatment, the legs have reduced in size. So sometimes we can wrap them for the first time, and after we unwrap them the first time, their legs are down. They're like, oh my God, I ain't seen my ankles in so long. Oh my God. And that's just after one wrapping. The wrapping is very aggressive. The first thing they'll say, oh my God, these things are tight. And they want to take the bandages off. My thing is, do not take them off. Just push through it, exercise, move. The more you move, the more you exercise, and help push that fluid out. But if you don't have the right compression or the right amount of pressure on there, the swelling will still be there. And then you'd be like, okay, well, nothing is happening. Why my legs ain't going down? It's not enough pressure on there to help push it out. So it has to be enough pressure, even though it feels tight. But if you bear with it, keep it on, elevate, exercise, you'll notice that the swelling goes down, the bandages become more comfortable. By the time it gets comfortable, it's time for you to come back into the clinic. We take those bandages off and tighten them back up again.
I remember I have a girlfriend who legs are big at the bottom of the calves and stuff. And when she was young, she was bit by a wasp. And so I don't think the swelling ever went down, but I mean, she just recently she had surgery on it, her leg, but it must didn't take an effect because now she had to have another surgery. And so,
Wow.
and so, it hurts me because she's having all these surgery and nothing being done with it. So what's that? What's the deal with that?
Again, a lot of doctors do not know about it. They'll just keep cutting, or my thing is, if I'm being cut that many times and I'm still having the same problems, I think I'm going to go ahead and try to find another doctor to see what's going on. That's just me, because I see it all the time at the clinic. Patients come in because they didn't went to this doctor for so long. They didn't had the same complication for so many years, and then all of a sudden you switch up, you go to somebody else, and then that somebody else say, oh, well, hey, you got such and such and such. And all of a sudden, next thing you know, the stuff that they were having before, now it's gone. So I would say try to switch up, see what else is going on, because a lot of doctors are unaware of lymphedema. They'll keep trying to cut. Matter of fact, way back in the day, years ago, with lymphedema, what they used to do was debulking. They would cut the lobes and the lymphedemas off of the patient's legs. It used to be called debulking because they did not know what to do with it, not knowing there were damage to the lymphatic system even more every time you cut on it.
So this is just like having therapy,
Yes,
going to
like
therapy
therapy.
every week. Okay, so this lady, Gwenda, wants to know how many visits a week do you have to?
We do, if it's full treatment, we do 3 times a week. If it's just bandaging only, it just depends on what the insurance will pay for. They'll come in like twice a week. But if it's really severe, we'll try to push it to them so that they can get in 3 times a week. If they're elephantitis, in other words, I guess that's the other thing, the different stages. There's
Yeah.
there's 4 different stages of lymphedema. There's stage 0, there's stage 1, stage 2, stage 3, and then there's elephantitis with the stage 3.
So
A lot of people
elephantitis is,
remember the Elephant Man.
yeah, elephantitis is a thing of lymphedema.
Lymphedema. Yes.
Yes. Wow.
Hmm. So if left untreated, and you keep on going and going and going, then you could be at risk for that.
You know, back in my days, you weren't here. Back in my days, there was a lady who had elephantitis, but there was no doctor to help her out. She just lived with it.
Hmm.
It's
Because they don't know what to do.
they didn't know what to do. So
And there's a lot of people in the area that like that today,
so
because
do
they don't
you
even know that our clinic exists.
Do we have
Ma'am.
specialists? Are there specialists?
For lymphedema, well, that's where you got me. There's not that many. There's not that many people certified in the area that does this stuff. That's the sad part. And being that there's not that many people, and we don't have no commercials telling you about it. So a lot of people living with it and don't know that there's help. Some people who finally make it to the clinic, they've been swelling for like 10 plus 20 years or so. And they like, well, I didn't even know you guys were here. I didn't know there was help here. Some people know that there's help, but they thinking they got to drive all the way to Houston to get it. They
Right.
don't even know that we're here. So then they don't want to take that drive, and the legs just get worse and worse and worse. And then their legs are weeping. Then they develop wounds. Then they develop cellulitis. We've had one patient, bless her heart, I remember this. She actually had her leg amputated because the infection got really, really bad.
Wow.
Because again, the lymphedema got left untreated.
Glenda says my feet goes numb after a ride in the car.
Yeah, it's recommended when you're taking long drives, at least every 2 hours, get out the car, get up, walk, move around. So basically, your inguinal nose controls everything below the belly button. It's almost like having a water hose. Okay. So, when you crank that water hose, what happens to the water? It stops flowing, right? So if you're driving in a car for long periods of time, you're cranking up your water hose. The water's not flowing down to your legs. So every so often you need to get up, open that water hose, your legs, in other words, get up, move, stretch, move around, or else, yeah, that would help. I mean, that would happen, the numbness and everything. So even when you take in flights, it's also recommended that you put some type of compression on, like a 30-40 on your legs, because of the pressure of the cabin will also increase swelling. Heat increases swelling. So a lot of people in the summertime, they probably notice that the legs or the arms get worse in the summertime because of the heat. Heat can cause swelling as well.
Wow. And the swelling is painful?
Sometimes it can be because it's a stretching of the skin.
Wow. Ooh, is it inherited?
Yes, that's the primary lymphedema. Primary lymphedema is hereditary lymphedema, which means that someone in the family had this, and then your genetic makeup, oh, you popped up and had it. So there's a lymphedema. The primary lymphedema is you born with it, like you came out your mama's womb with having some type of swelling. The second one is that you develop in your 20s, and then the third one is when you develop in your 30s. So like my nurse practitioner I work with, she'll say that you've had an expiration date and yours then shut off. Like if you're in your 30s, yours then shut off. So we also diagnose it as primary or hereditary lymphedema.
Wow.
So yes, you can inherit it from, years, from your grandmother, your great grandmother, your aunt, somebody in the family.
Mm-hmm. Wow. Gwenda says my legs are so high I can't find compression socks.
Right. So basically, that's where she would come into the clinic. We would do the multi-layer compressions to help get those legs down so that we can get her into some type of compression garment to help maintain it.
Well, it's really nothing but fluid, right?
It's fluid. It's not just fluid. It's the lymph fluid. So it's the chronic rich protein fluid. Give you a prime example. So everybody's cooked dry beans before. I would guess. You know how you take the dry beans?
Yes.
You know how you take the dry beans? Okay, so the beans are protein, right?
Right.
So you put the beans in a pot, you add water, you let them sit overnight. What happens to the beans, which is a protein-rich fluid? They
Right.
swell up. There you go. So same thing like lymphedema. All that protein and the water hits it, and your legs just swell up, just like those dry beans. That's where we come in again. Get the multi-layer wrapping going on there to help compress to get that fluid moving up and out.
You seem like you enjoy your job, of helping others, get where they need
I
to.
do.
And
I
so,
do.
yeah. So, do you do this on the side, like have patients on the side besides at the Baptist area? You
Yes,
do.
I do.
So,
I
how
do.
could
That's why I don't get home till like 9:30 at night sometimes.
so
I
so
have nothing else to do.
how could people get in touch with you? Should they
They
call
can
you,
hit me.
or should they call the hospital and you do?
They can
But
call the hospital. That way we can do a berry of workups, make sure they don't have any blood clots in their legs. They can get seen by my nurse practitioner uh, and see what's really going on to actually make sure that it is lymphedema. So a lot of times I get my patients after they go through treatment and they don't have anybody to help them. And they get into a situation where I don't have this person. I tried to do it, but I can't do it. Hey, Katina, can you come over here? Because I need you. So I see patients like maybe once a week, twice a week. I go out, I give massages or give the wrappings and other stuff. And now they got this thing now where a lot of people are getting the tummy tucks and stuff. So now with the lymphatic massage therapist, they're like, hey, I had this surgery because again, you're at high risk of developing lymphedema now that you had the surgery. So that's where I go in to give them a massage to help redirect that fluid. So once they come in through the clinic, then after they finish treatment and everything, a lot of times I'll go out and see them after that. That way we know what's going on, make sure that they're not, getting harmed in any way.
Joetta says she is awesome, and she also said great at what she does. So hey, I told you
Thank
earlier,
you, thank you.
I trust Joetta. So Jeanette says the therapist will measure your effective area and order custom-made stockings to fit their legs. So I guess she's telling this to Gwenda, and so, since you can't find the compression sock for you, so that would be you, right? You will measure the
Mm-hmm.
leg,
Yes,
and
ma'am. Yes, ma'am. But a lot of times we will get that leg down before you put it in the compression wear. The reason is when you go into compression wear, it just helps to maintain what you have. Compression stockings do not help to get the fluid out of the body. That's where the multi-layer compression bandages works at because the compression wraps helps to push the fluid out and the
Mhm.
compression stockings help to maintain what we have done. Because a lot of doctors will do that too. They say, oh, your legs is swollen. Let me write you a script for some compression stockings. That's the worst thing in the world. Because if your legs are swollen and you put those stockings on, what will happen is them stockings will sink into the legs and cause pressure. Pressure will cause pain, and so much pressure on that spot will cause a pressure ulcer, and now you have a wound because your doctor said to put you in compression stockings because he didn't know about lymphedema. And then he's calling you fat and all this other stuff, which leads to, I was telling you, there is a diagnosis of lipoedema or lipedema. Basically, that is lymphedema trapped into the fatty or adipose tissues in the body. Now, that is basically a woman's disease. Not too many men have that. And what that is, a lot of people have seen them. Obese people, they have big hips, big butt,
Right.
big legs, and small feet. Like the feet are really small, no swelling in there. So that would be lipoedema or lipedema, as some people would say.
Right.
We treat it the same. The only thing is, once we get the fluid out, you still have the fatty deposit, the fatty tissue.
Mm-hmm.
But there was a clinic in Georgia, if I'm not mistaken. Once they get the fluid out, they go and have liposuction to get the fat out. But
Right.
then you wear compression stockings thereafter to help maintain.
Well, what Glenda said she had blood clotting, so you're not supposed to wear compression socks with blood clotting, right?
Right. So basically, what happens is once she goes through everything, we do the testing. We see how if it's a chronic blood clot or is an acute blood clot. Then if it's acute, then we'll put you on. I'll put the patient on some type of blood thinner to help get that going. Once they've been on there for a while, then yes, they are able to be treated. So yes, there's still treatment. It's just going to take a little longer process before we get started.
But some people who have blood clotting don't know they have blood clots in their body or whatever.
Correct. Exactly.
And
So
so
that's why
it's
we
very
do
dangerous,
testing first.
which is very dangerous, because
Mm-hmm.
blood clots go real fast, right? They
Correct.
travel fast.
Correct. Yes, ma'am. So that's why before we do anything aggressive like that, we check the blood, not really check the blood, but send them through testing like a venous Doppler to rule out any blood clots. Check the ABIs. It could also be, like I said, chronic venous insufficiency. So then sometimes my nurse practitioner who I work under, she'll order a chronic venous insufficiency testing to see if it's chronic venous insufficiency. If it is, then there's a doctor there to take care of it at Baptist. Then once he finishes, and if he sees that the swelling is still there, we get the patient back to treat them for lymphedema.
um Lillian, I'm sorry, not Lillian. Gwenda wants to. Let me see if I can get over. So this is my description: big butt, little waistline, and they on an A cup in my bra.
So she probably has lymphedema.
So I don't know. So what do you have, Gwenda? I think she has. What'd you say she have?
Lipoedema. Some people say lipoedema or lipedema. So
Okay.
however you want to say it.
Oh,
It's
Jeanette
Lipoedema. Yeah.
said she's on blood thinners because
Oh, okay.
because I had several blood clots.
So before we treat, we just want to make sure it's good and she's secure before we even start pushing anything, because we don't want to make, we don't want to cause more damage than good.
Right, because like we said, the blood clots they travel real fast. So how do you stop them?
What, the blood clots?
Mhm.
Well, a patient is put on medication. Either they could get on Coumadin, but normally my nurse practitioner who I work under, she put them on Xarelto.
Uh-huh.
And then after that, we do like another Doppler like 30 days after that to see if it's working, if it's progressing, what's going on. If it becomes too severe, again, there's a doctor there at Baptist, Dr. Morrison. He will take care of those blood clots depending on how bad it is or what's going on with it. So
And
we have somebody to treat it.
even though you do have lymphedema, I'm sorry. Even though you do have lymphedema, you can still live a happy life, right?
Yes. It's like learning to live life a different way.
In a different
There
way.
is a lady, yeah, there's a lady on TikTok. She's a black lady and she has severe, it looks like stage 3 lymphedema. I don't know. I didn't touch the leg, but her leg is like humongous on one leg and she has a very small body. She has primary lymphedema, so she was born with this. One leg looks absolutely normal and the other one is like 10 times bigger,
Wow.
but she puts on her stuff, her shorts or whatever. She's also a model, so she models this stuff as well. So it's just learning a new you of you,
Right.
learning how to cope with it, learning how to deal with it, learning your do's and don'ts. I know if I do this, my leg gonna swell. Well, okay, well, I learned how to bandage, so I need to bandage it up. Okay, well, I need to wear my compression. Oh, I need to pump. I need to exercise, watch my salt. It's learning a new way of dealing with you, but live life to the fullest, because you only get one and life is short. You could be here one day, gone the next. You can't let that stuff just
Go on the
stop you
same
from doing stuff.
day. You
Yeah,
hear
you just
that
have to
all the
live it.
same day. Yes,
Yeah,
yes.
that's true too. Yeah, that's
Mhm.
true too. You just have to make it. You got to keep on pushing through, because just because you have that, somebody else can be worse than you. They can't get out their
Personally,
bed. They can't do
right.
this. So, hecky, get up, move around. Matter of fact, one of my girlfriends, we became friends because she was actually one of my patients, and she was the stubbornest patient. Miss Angelique Smith, I'm gonna call her out like that, but she was a very stubborn patient. Every time I wrapped her legs, she would take the wraps off. She said they're too tight, they fell off. And I was like, then wraps did not fall off. Eventually, she came out and she said she took the wraps off. But after she actually listened to what I was saying and went through the treatments and everything, her leg went down.
Right.
She lost weight and everything. She is living her life to the fullest. She's going on trips. She don't care about that leg. Every once in a while, if it gets too swollen, she'll say, "Hey, can you wrap my leg?" But in the meantime, she's living her life. You can't. Well, first of all, people think that somebody's always talking about them. People gonna talk about you regardless. You
Yeah,
can have a body so fine, and they're gonna find something to talk about. Let
something.
the people talk, because they're gonna talk anyway.
Exactly.
So get out there and live your life. You can't let that stop you from living your life, because people are gonna talk. You just gotta keep on pushing, keep going. Enjoy life. You know,
Yeah. So what type?
don't let it stop you.
I know you wrapping the legs or wrapping whatever. What type of clothing can one wear?
So when they come into clinic, it has to be something loose, because when we
Mhm.
put these bandages on, the bandage will be very bulky. There was
Okay.
one patient, she would get her pants, I think off of Amazon, where it's the big wide leg pants, but they flow. So when you
Right.
put the pants on, you can't even tell that she had the bandages on half of the time, because the pants was big wide leg. Or some patients wear dresses. It just depends on your discretion. But don't come in there with no tight jeans or no leggings.
That's a no-no, huh?
Yeah, that's a no-no. Although I did have a patient do that. He used to come in there with some starch jeans. He would not get out those starch jeans. He made those starch jeans go over those bandages. He was not stopping his flow.
So men get this as well? Oh, because
Yes,
you said
ma'am.
scrollers. You did say scrollers and everything.
Scrotal edema. Yes, I have
Yes.
patients. I have to wrap the
Wow.
men's testicles.
Right.
They
Yeah.
call me the warden for some unknown reason. They say I wrap too tight, but hey, I get it down.
We had a principal who had that, but like I said, back in the day, they didn't have anything to cure that or any treatment for. But I mean, I can't tell you what we used to call him. Well, he's deceased now. We used to call him Trick or Dick because it was so huge. We didn't know what was going on. You know, we were young.
Edema, yes.
We were young, so we didn't.
Yeah,
We
men
were in
get it
middle school,
because they
junior
had
high school. We called it. Yeah. Oh my
men can get it because of prostate cancer. Yes,
We didn't know about
yes,
that. You know, we didn't
yes.
know about prostate cancer because that
Right.
it wasn't known then. As it is now. She
Yeah, but if it gets too bad in the legs, the fluid can keep traveling. So some men can develop in the prostate or in not the prostate in the scrotum. Some women can get it in the vaginal areas because the fluid will keep on going. So a lot of women say, "Oh no, my cat been always fat," and you're like, "No, that ain't right."
yeah.
You know.
Joetta says if you want to talk about it, I can be reached on Facebook. Joetta is Minister Lawkins, and she's awesome. I tell you, that's my girl right there. And then she's gonna call me out, Deborah. I know why you calling me out because I call that man. That's not calling. Jeanette says she's on Xarelto. I have been going to lymphedema clinic since I was about 25. One of my legs is larger than the other, and that works. Maintenance stage is very important to living with lymphedema.
Yes, it is. She's
Yeah.
right.
So she look like she know a little bit about it because she's
Yeah,
lived
she's
with
been dealing with it for a long
yes,
time.
she's 7 years old. Wow.
Yeah.
And you can't
Yeah,
have
we
it
are.
at
Yeah,
that
we
young
have
age.
a 1-year-old that have it.
Are you serious?
Yeah, yeah.
So
We have babies that now we have one little one. I think she started with us. I think she was 7. Now she's like 15. She comes in every so often to get, new garments, making sure she's doing okay.
wow.
And she's living her life.
I guess.
That's the key to live your life,
That's the key to living your life. Yeah.
Mhm.
Because you can live your life. I mean, there are, like you said, there are other people out there worse than you are.
Correct.
So you need to just live the life that God has given you. I mean, He only gave you one life, so
Exactly.
live it to the fullest.
That's all you can
Like
do.
you said, people gonna talk about you. They're gonna talk about you regardless. Whether you
They
get
talking about us right now.
right now, you got your dress on backwards or whatever. I wore my blouse to work one day and it was on backwards, and they talked about me. But I care. A long time ago, though. Not that I'm cute. So how can you be reached besides this number right here?
Or they can inbox me on Facebook. They
Yes.
can look for me on Facebook, hit my inbox, and contact me that way.
Okay. So her name is Katina Williams, and she is on Facebook as Katina A. Williams. She will reach out to you, and would you rather them message you or not? Because
Yes,
yeah,
yeah. They can message. Yes.
yeah, because people nosy. Yeah, I know that. Glenda says she just found out about 4 or 5 years ago, but I've never been able to wear boots because my legs as a teenager was too huge, but I didn't know it. So
Yeah.
Glenda, you must have had it when you was a teenager.
I think that was the one that said she had it since she was 7. No, maybe it was
That was
more.
Jeanette. She said she had.
Oh, okay.
Yeah,
I'm getting the two mixed up. Okay.
yeah.
Yeah. So one of them, I think, when she described it, I think it might be lipedema or lipoedema, where
Mhm.
she said that she had the big butt, big hips, And
Right,
with the lipedema, yeah, it is kind of hard. Like I said, you can get the fluid down, but you still have the adipose tissue.
right, right. Wow. So what do you want to leave our listening audience with as far as lymphedema and how they can detect it, or how will they know that, yeah, how can they detect it and how will they know that they need to go to the doctor to find out whether it's lymphedema or where it's just your socks are too tight or whatever. What you want to leave the audience with?
So basically, if you've had any type of surgeries and you notice that you have swelling in the legs, or women who've had breast cancer, they've had a mastectomy, they've had radiation treatments, pay close attention to it. Do measurements on the arm and make sure that you catch it before it gets too bad. So far as for the legs, if you start noticing that your shoes are too tight, your feet are too tight, um, even if you wear like a toe ring and you notice the toe ring is getting too tight, any tightness, if you elevate it and the swelling is not going down, or if you try fluid pills and the swelling is not going down. Some people actually put on compression socks because they say, oh, well, I know about these compression socks. If the compression socks get too tight or painful, definitely pay close attention to that, and if it's not reducing in any kind of way, definitely, go get checked. If the doctor says, well, we're going to put you on fluid pills, and you take the fluid pill and the swelling is still there, and you go back to him and he fuss at you, tell him, well, you got too much salt in you, or are you too fat, you need to lose weight, then I would say leave that doctor alone and go to somebody who knows and somebody, who cares. They actually had a patient came in and she had swelling in her arm due to breast cancer. She went to the doctor and was talking about how her arm was swelling. The doctor told her a whole bunch of other stuff. She went to the bathroom, and when she went to the bathroom, they had a lymphedema poster for, swelling to the arm from due to breast cancer. She went back to that doctor and she said, you know what? I think I have lymphedema. He said, well, how do you know that? She said, because the poster that you got in your bathroom told me that. He had a poster in his bathroom, but yet he didn't even know about lymphedema. Yes,
Wow.
that's because a lot of doctors are unaware of it. That's the sad part. Very sad. So if you start noticing swelling and it's not going away with elevation, if the doctor puts you on fluid pill and the swelling is still not going away, and if you develop cellulitis, that's a key indicator that it possibly could be lymphedema. If you have color changes of the skin, we call it hemosiderin staining, where it's like a darker color than your normal leg color. That could also be chronic venous insufficiency or a mixed disease of chronic venous insufficiency and lymphedema. Best to go ahead and get it checked. That way they can correct the chronic venous insufficiency. However, you also may inherit lymphedema because of the damaged lymphatic system from the chronic venous insufficiency.
Wow.
It's a lot.
I feel say it's a lot. You
Hmm.
feel like you probably don't even have it, and you think you have it because you're swelling. You know.
Yeah. But that if you just swelling, elevate, and if it goes down, just know that you've had too much fluid intake or something else going on. It could be heart, it could be kidney.
Right.
Pay attention to that. If
Right.
you press down on it and it sinks in, it could be heart or kidney. A lot of times, if you have lymphedema, it does not go down like that. It's very, very like a spongy fibrosis. Like if you have like a bath, not a bath sponge, but a kitchen sponge. You know how the sponge goes down and how it feels. Lymphedema is something like that. If it's straight edema, it'll just be pitting, like a deep pit, a hard pit. It's a different feel of it. I guess because I've been doing it for so long, it's kind of hard to describe, but it's a different feel of it when
Wow.
it's just straight edema as opposed to lymphedema.
Right. 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 And you did tell us the difference between the two. So, wow. I thank you tonight. Let me see who else
You're
is
so
saying
welcome.
something. Diana says, good job, Katina. There is also a clinic at Jasper Hospital for people who live further that way. Great. Jeanette says, thank you for addressing lymphedema and get the word out in Beaumont that you are there. And Joeltha says, Deborah, you are so grateful. Need people to know there is hope. Thank you. Thank you guys for joining us tonight on Blue Table Talk. Like I said, I've been out for a couple of weeks, but I'm back and I might have to go out again due to some circumstances. But I will be on and I periodically, and I really, really, really appreciate Katina for coming on tonight. I called her to ask her. Joelfa is the one who inboxed me and asked me to get you on because a lot of people don't know about it. And so
Hmm.
I didn't know about it. So I said that sounds good. So thank you so much,
You are
Katina.
so welcome.
I appreciate you. And if there's anything that I can do for you, if you want to come back on to talk about anything, just let you have a number, you have you got my email, you can get to Joelle or whatever. So just contact me, and I appreciate you. Um, One more person says, "Great information. Thank you for sharing." And thank you guys also for viewing Blue Table Talk tonight. We on Facebook as well as YouTube. And all you have to, if you go on YouTube, you look up whatever the title of the show is, and then under Deborah Jones, and then it comes right to it. God bless you. God keep you. Is my prayer. Next week, I'll be on next week with Kendra Hill. He has this boxing studio. It's called, let me turn around for a minute. I forgot. It's called 409 Elite, and it's in Beaumont, Texas. It's on Washington Boulevard, but it's a black-owned business, and he'll be on next week. We'll talk about. I might just go in the studio do a little boxing match. Who knows? But like I said, Katina, I appreciate you. God bless you, sweetheart. You are just a
Thank you.
jewel. You are a jewel. You are very knowledgeable about your work. You're very loving about your work. It seems that you care. And if anybody need to get in touch with her, the number is going across the screen. Baptist Hospital 409-212-6121. And get in touch with Katina and let her help you out. Because we need the help. And I'm sure she'll be there for you. Smooches,
Yes.
everybody. Bye. Thanks, Katina.
Bye. You're welcome. Thank you.
Bye-bye.